Hello and welcome to Altasciences Sample Collection Kits and Laboratory Manual Services presentation. My name is Mathieu Saunier. I'm Director Operation for the Technical Support Group, and today we'll be presenting Dipali Patel, a Supervisor of Material Management. Dipali has been part of Altasciences for 4 years now and is supervising all sample collection and laboratory manuals.
Thank you very much, Mathieu. We will be covering today the logistics and preparation for services to delivery of the goods, standalone label services, clinical sample collection kits, lab manual, along with additional services our team can offer for our clients' studies. All the services that we discuss today are customizable to the study. Depending on the study setup, some might require only labels. They might require label and clinical sample collection kits, or the whole package, which includes our custom labels, clinical sample collection kits, lab manual services, along with shipping support and biorepository services. We have worked with and continue to work with all ranges of studies and projects. Kit services have been provided for projects ranging from 15 patients to over 600. Single to multi-site studies with 70 plus study sites. Kits have been shipped to countries all around the world, ranging from one country to multiple. USA, Canada, South America, Australia, Japan, and Europe. Logistics in preparing for service and delivery. The goal is to provide the study with maximum tools to minimize errors and ensure sample collection and processing is followed. Bioanalytical laboratories depend on these processes to be able to generate good data. Starting all requests by working in unison with the sponsor, this allows us to understand the needs of the project and the clinic's requirements also. In all stages of preparation, we ensure that our clients have their say. From lab approval, from label approval, and lab manual revision, finalization is processed only after we receive the okay. At the same time, we ensure to work closely with our Altascience teams, our scientists, client and project managers, and business development, who also are in communication with sponsors. Working together and staying on the same wavelength avoids clients repeating themselves and links to our Tell Us Once pillar. Advantage of services. What are some of the advantages your study will receive if you opt in? We have observed that the time from sample reception to samples being available for lab analysis is reduced drastically. This results in our laboratory being able to meet accelerated timelines. Before reception of samples, the study is already created in our LIMS system and revised by scientists, reducing additional communication and delays that could be created when external labels are used. Pre-printed information allows for less deciphering when sample reception is being conducted. These services are used for when samples will be analyzed in our bioanalytical labs, but also have been provided for external laboratories. A pre-populated manifest is provided upon shipment of goods, allowing external laboratories to also accommodate our labels. Although we have worked with many central laboratories, it is not a requirement. The organization of the labels and kits provided by Altasciences with our LIMS systems allows for all sites for any study to ship all bioanalytical samples directly to Altasciences laboratories. This allows clear direct communication with sites and the bioanalytical lab without a third-party involvement. Sample collection kit services. Opting for our services, a detailed look into the best option for your study. The labels provided from Altasciences offer various advantages. Labels allow clean and clear information, reducing errors in clinics and laboratories. The LIMS system used to generate the labels assign unique barcodes per sample and aliquot. There's never a duplication, increasing traceability of the sample. 2D barcode option can also be provided. Our team always suggests that maximum possible information be pre-populated, as handwritten information can increase discrepancies. For instance, the handwritten writing cannot be deciphered or information has been erased. Color-coded option can be used to differentiate collection types or even aliquots. For example, aliquot 1 can be provided in white and aliquot 2 in pink, allowing for easy shipment of for clinics and also processing in laboratories. Labels are approved for storage in at room temperature, 4 degrees, minus 20 degrees Celsius, and minus 80 degrees Celsius, and used for sample collection in various matrices: blood, plasma, serum, feces, urine. With the years of experience, we have received samples with labels that don't have water-resistant ink, resulting in writing being removed. Sometimes no barcodes or not enough detail on the labels. All these contribute to sample discrepancies and long wait times before lab analysis. Our goal is for your study to advance with the best tools for best success. Clinical sample collection kits. These are customized to each study and their needs. Organized and provided to facilitate sample collection for clinical sites. Whether your sites are experienced or first-time medical offices, they are made for your time point to be collected. The kits are well identified, typically packed by visit or period and time point. The supplies, for example, if for plasma samples, the blood collection tubes and storage tubes are pre-labeled with our LIMS system. Ready for collection, each bag is identified with the corresponding information. For multi-site studies, this allows for all sites to receive the same material and follow the same processes. Shipper boxes and return sample materials can also be provided. Kits have been built for both single matrix and also collections that require multiple matrices, for example, plasma, serum, and urine, and have been used for a range of patients, from babies to the elderly. We have worked on studies where kits go from clinics to the home with the patients for at-home collections, and also have been used for when studies require to follow the patients from hospital to in-home collections. Additional documents can be provided, for example, kit resupply form, which allows sites to request for supplies and is created to make the interactions with clinics and our team as clear as possible. Since it is important site staff are familiar with the material before the collections, shipment of kits is delivered before the start of the study. Each shipment is followed by a tracking and shipment confirmation email and tracked for delivery to sites. The laboratory manual is a detailed document for supporting the clinical sites and consists of instructions for how the sample collection kits are organized and their usage. For example, it directs the sites on who to contact at Altasciences when the supplies are required. Step-by-step sample processing instructions for each type of sample collection that needs to be conducted. Sample shipment guide to ensure all sites follow the same processes and are directed where and who to ship the samples to. The document is customizable and may contain forms for sample kit tracking, sample collection log, and inventory form, depending on the clinical need. Step-by-step detailed sample collection, processing, and storage is also provided. As each laboratory method is different, the manual guides clinical staff in following important steps to ensure samples are collected correctly, not affecting analysis and the results. This, along with the forms, aims to reduce the amounts of deviations. Altasciences team offers supporting services during all phases of the study trial. At the start of the study, site initiation visit participation, sample shipment support and guidance when sites are ready to conduct their shipments. For multi-site studies, we have coordinated with large courier companies to ensure smooth pickup and deliveries. Our sample reception service provides a confirmation email when samples are received in our laboratory. Discrepancies are addressed and processed before samples are available for analysis. LIMS system ensures sample tracking at all times as it enters our facility and is stored in freezers. Biorepository service with temperature monitoring 24/7, all 365 days in the year. Sample storage options from room temperature 4 degrees, -20, -80, and cryogenic storage. Samples shipment and disposition services for when study is completed. In summary, our services are there to support the clinical trials in having the maximum tools to proceed with sample collection and processing, all the while minimizing discrepancies and their impact on the study and data. Experienced in working with trials of all phases from multi-site to single site, shipment of kits have been conducted to all sites around the world. Pre-printed information on labels and easy-to-use sample collection kits leads to less room for discrepancies. The lab manual option ensures all sites receive the same instructions and follow the same processing and collection procedures. Opting into these services have shown also to reduce the times in sample reception once samples arrive in our laboratories. All services are personalized and customizable. We understand each study and client is unique, working closely throughout the study from start to finish. Thank you for taking the time to listen in today. For further questions, we welcome you to reach out to us and also visit us at altasciences.com.